welcome. And the biggest, obviously, welcome to Vandy, Bramble, and Patricia, who have agreed to do a spotlight with us today. So I will do a bit of an intro, just if this is your first conversation station, just to kind of welcome you, set the scene a wee bit. But everything I think that you probably already know, I'm sure. But yeah, today we are with FoodSEqual, or part of FoodSEqual, with some community food researchers, Vandy Butcher and Patricia Douglin, and we also have Bramble Gardner as well, who are going to be talking about diet inequalities in the community in Reading, as part of this wider project looking at how to make changes to the food system that work better for low-income communities. So really excited to do that, and I'll be quiet very shortly, but just to set the scene, this is part of Community Knowledge Matters, and one of our kind of key network values, which we always share at the beginning of our meetings, is equity, inclusivity, collaboration, respect, and integrity. And we co-developed this at the very beginning of our network, and Sophie has put in a bit more about those beliefs and what that means. But I suppose in terms of what that means in practice for this space, of course, we want it to be a respectful space, so do be kind, courteous. I'm sure you all will be. If you're listening, I encourage you to be on the mute function, and do feel free to kind of look after yourselves. If you need to turn your camera off, if you're eating your lunch still, it's a bit late, or having a cup of tea, whatever, feel free to engage as you see fit. There is auto captioning on if you'd like. And also one of our key values as a network is about language and recognizing that we're all coming in from different hats. Some of you, well, mostly communities, but of course, those of you from research or practice or different nations. And so we have our jargon jar Padlet, which is kind of our tool and reflective process to think about language as well. And we'll be checking in on the jargon jar as we go along as well. Of course, we definitely welcome questions. So once I've set the scene, I'll be handing over to our guests, and they'll be sharing for about half an hour, and then we have plenty of time for discussion as well in that last kind of 20-25 minutes. And so, but if you've got any questions in the meantime, if they come up, throw them into the chat. We'll still save them for the very end, but I think that just so you don't lose it, you're very welcome to do that. And obviously just being aware of sharing the space and time as well, especially once we get to the discussion. And we are recording the talk, so these will be shared on the website afterwards. So if you, we should be able to edit it so you're not in it, but if you want to be double sure, you can turn off your cameras if you're listening. But the discussion itself won't be shared as well. So it's only the talk part, and then we're also transcribing it as well, which is just for our own notes. So just so that you're aware, and I think everyone here is a member of Community Knowledge Matters, but just as a reminder, as a network, we are supporting community-led research, centering communities, we're building connectivity, we're sharing practice as peers, and we have our kind of newsletters, our training, our resources that we can try and compile. And we also are trying to support this advocacy for better, more equitable community-led research, informing practice and policy, both in Scotland, but increasingly across the UK and internationally as well. So welcome. And today, this came from a chance meeting actually with Bramble at a conference a couple of months ago now, weeks ago, the UK Participatory Research Network. And I saw this very enticing poster about, so you're thinking about becoming a community researcher, and it's just proof that posters do work. And I was intrigued, and this link to a handbook, which I know these guys are going to be talking a wee bit about as well. So maybe without much further ado, I'm going to stop sharing my screen and introduce Vandy, Patricia, and Bramble. Thank you so much for joining us.
Thank you for having us.
Thanks. Great to be here.
Awesome.
Great. Yes, I think, is the slide sharing working?
It's just about to load, and there it is. Beautiful.
Cool. Okay. Yeah. So me and Vandy and Patricia have been working together for some years now, I guess, with lots of other people. And we've kind of planned a few questions to talk about. So I guess I will try to get going. So I guess, yeah, FoodSEqual as Lewis just mentioned, was a project which is just finishing that worked for 5 years and worked with community researchers to try to look at diet inequalities in their communities or communities they were connected to. Reading is one of the areas of FoodSEqual with Patricia and Vandy. They've done excellent work there. And one of the other areas was in Plymouth. And there was other researchers there, which Patricia and Vandy have met. And this is a short animation about the FoodSEqual work in Plymouth that was made. So yeah, hopefully you can enjoy this. It's only 3 minutes long, and then we can have the questions.
FoodSEqual Plymouth has been about community-centered food system change. Here we celebrate the collaboration and achievements of everyone involved.
So we spent 5 years working with Whitley Community. 6 local people were trained to be community food researchers.
I'm Joe.
I'm Joanna.
I'm Eve.
I'm Star.
I'm Julia.
I'm Laura.
They helped us connect with the wider community.
We ran a fruit and vegetable voucher scheme based at a local community hall and an outdoor monthly market in the community. The market was a really important feature of the scheme, bringing very fresh, affordable produce to the community on a regular basis. People got to know us, and it made the scheme accessible and more visible. One of the participants told us,
This project has really helped us with our health. The staff are really friendly and polite. Before I wouldn't even talk to other people and be stuck alone indoors, but now I have the confidence to go out and talk to people.
Tamar Fresh were incredibly supportive. They gave us insights into their business of supplying and selling fresh fruit and vegetables and their processes, and they provided seasonal produce for the project. We learned a lot from them. Another participant told us,
I am eating much healthier and lost 4.5 stone since I started using Fresh Street. I'm doing more for the community and getting out more. I'm now cooking meals from scratch regularly using the fresh fruit and vegetables.
Hi, I'm the Plymouth fish finger. You might have already heard about me. I'm made from fish that would have been wasted. FoodSEqual made the plan to make me into something much yummier. School children from Sir John Hunt worked with Caroline and Ed to design and create me. I was eaten and tested by school children and people in Whitley community, and they loved me. Now they are working out how to make me on a bigger scale. Keep an eye out for me, because I'll be popping into Plymouth school dinners soon.
Hunting dogfish, whiting from the skipper's line to the school meal queue. Co-created just for you.
This collaboration has built really strong foundations for community-centred food systems change in Plymouth.
So watch this space.
Thank you to everyone involved.
Collect up all your goods, all those rainbow superfoods from the fresh street stall in the morning. We'd like to thank you all for your stories, big or small. You've made it a success for our project FoodSEqual. Let's share and celebrate all the veg that's on our plate, saving leftovers to eat in the morning. Let's share and celebrate all the veg that's on our plate, saving leftovers to eat in the morning.
Oh, thanks very much. How was it to see that?
That was good.
Oh, amazing. Well, yeah, good. And then, so that was the other project, the kind of the parallel project that was happening in a different place, which is why we didn't see your bonny faces. I feel like you should introduce yourselves. Like, I'd like to hear, like, what your background was, and I guess what your role was, and also, I guess, what attracted you to be involved in a community research project about food in particular. Like, Patricia, I know you mentioned a bit about working in the community beforehand, but even Bramble, how were you involved, Vandy? Where have you come from?
Well, I started as becoming a researcher. I started by doing a FoodSEqual, not doing a food surplus in Whitley in the community centre, and that's how it led on to me being asked to be a researcher for the university. So yeah, I was just helping at the food. It's not a food bank, but it's a food surplus, and dealing with community every day and just making sure that they can get the stuff that were donated, just helping it to run smoothly and so on and so forth. Yeah. So, yeah. And I used to drive ambulances before that. But yeah, it's always about community for me anyway. Yeah.
I really feel that. That's beautiful. How about you, Vandy?
Well, with me now, I was fostering for 27 years, and then I stopped. I'm thinking of going back, so don't worry. Right. So then, so I was on the food surplus at the hub as well, and from there, I did many jobs in there, working in the kitchen, cooking, and things like that. But along the way, I was asked if I'd like to be a researcher, so it was like, okay, just one of many things that I do. Why not see what it's all about? Yeah. So so that's how I got into it, by just being asked and asking why me. And I was told that you have a good way with the community. You can talk, laugh, you're caring, things like that. And I was like, oh, is that really me? So yeah, so that's how I got into it, by just being me, just ask, being the person that I am. So I was able to help other people. Yeah.
Thanks, Vandy. And how about you, Bramble?
I think I worked in like community stuff for a long time, community arts, community food, etc. And a few years ago decided that I was a little bit concerned about all the barriers that seem to be in place for community projects. So I started trying to do a PhD to see what I could do to help that. And my PhD is about FoodSEqual. So I was or am finishing a PhD looking at how the research process worked. But I also later got employed by Reading to actually work there and help with the community researchers. So now I'm kind of doing both, like working in the project and researching on the project. I'm not sure. Yeah.
There's that kind of like, the multiple hats and lenses that you're bringing in, which is, you're in it whilst also thinking about it as well. What was really nice seeing in the booklet, and the booklet's really, it really brings that kind of the reflections and what you did, and like actually the screen you shared actually had a bit of an idea of what you did as researchers. So Vandy, you already mentioned it, and you are incredibly charismatic, and I could see that you got the gift of the chat for sure. Patricia as well, of course. So there's the manning of the stalls. There's the kind of, I think it mentioned things like analyzing some of the data, facilitating. I guess I'm just interested in that kind of the nuts and bolts of like, what did you do as a community researcher that might have been either different or even not so different from what you might do in your other work in the community?
Well, me as a foster carer, I was working with children. So children 24/7, they came, they stayed. I looked after them. They came from backgrounds, all different kind of backgrounds. So part of that, I was able to connect with people, because these are young people, and you had to connect with the social part of it, the family part of it. So that helped me say, yeah, maybe I can do this, because I've already done, 27 years of it. And so that's That's how I became a carer, and then a researcher.
And do you feel like those skills did translate in terms of what you already knew? And
Yeah, because in the way you have to be with people, because you're engaging with people every day, and you're engaging with children every day. So taking that on the streets to talk to people, you're engaging once again, and it's all about a caring kind of view, a way that you talk to people. Because people, if you're rough to people, people don't want to talk to you. You know, it's like, hey, can you do this questionnaire? People are going to say no. But if you talk to them nicely and tell them what you're doing, tell them the outcome, tell them that there's an instinctive thing that, you know, even if it's a voucher for joining the sessions, you know, which normally used to win people over. Yeah. So, so yeah. So, by doing that kind of line of work helped me with this. So at the beginning, I didn't think so. I didn't know what I was going into, but it does entwine with it as well. Yeah.
beautiful. How about you, Patricia?
What was the question again? Sorry.
The question was, I guess, what did you do as a community researcher? What kind of things, you know, talking to communities? And I guess maybe there's something there about your previous work as well. And like, did it fit? Was it very different from what you've done before, or was it actually very similar?
I find that people, wherever you go or whatever job you do, is quite similar. People are just people, you know. I'm used to community because I'm the youngest of 9 children. We have a very big family, so I'm just used to a lot of people being around me. And I also done care work, and was dealing with the older people and looking after them in their homes and stuff like that, and just getting, you know, to know them and their wants and their needs, and having empathy, knowing that some of them don't see their family from day to day or even year to year. Do you know what I mean? They're just being left there to just get on with it. And, you know, it just made me feel sad and just wanted to be there to help and stuff like that. So I've always been sort of like in that field where I just want to be in a position where I can help in some way or the other. And volunteering at doing the food surplus sort of like, you know, led me to, like I said, doing the research. So yeah, I think those skills are just being around people, trying to be in a position where I can make a difference is good enough for me. That's enough for me, you know. And yeah.
Ramble. Did you know? It's
I
beautiful.
just
Thank you.
want to highlight, because we've talked more about the like background and part of the handbook. There is a bit in the handbook which is specifically about saying, you know, there's such a thing about academia, like who is a researcher. It's really like a loaded term, and actually everyone has research is this kind of research is more about relationships and interpersonal, and everyone you know can bring their background. And so there is actually a section in the handbook about that, saying, you know, what have you done in your life? You probably have people skills and communication skills, and so that has been a big thing that we emphasized in the handbook as well. And I wanted to also draw it to the point about what we did in the activities, because like you guys did loads of things. Like you were you know, like researchers were coming and you were showing you research ideas, and you were telling them what would work for the community, like kind of, you know, sorting out the question, like, you know, we changed the questions, or we like talked about the methods. And then there was loads of things like food diary. Did you food diaries, like questionnaires? Then you were actually like gathering data. I don't know whether you want to talk about some of that stuff as well.
Some of it was asking questions like, you have a oven, you have an air fryer, you have a microwave, you have these certain things that you cook on. What were their best ways of cooking? Yeah. And a lot of people actually chose the microwave because that was quick and easy. A lot of people didn't want the microwave because of the radiation that you know, you hear all sorts of stories. Yeah. So people have made up their minds on that. And we did pulses. We did pulses which we made into crisp, and there was testing them, blind testing, putting them in a little silver bag and putting the bag near the table in the stuff in the bowl, and you was to taste them and see which one you liked, and we was hopefully going to see if we can get them, made on a larger scale. So yeah, so we did a lot of things,
experimenting basically.
Yeah, so there wasn't just doing questionnaires, there was workshops, there was so much other things to do
Oh,
as
you did
well.
eye tracking as well, wasn't there? I've just
Oh,
remembered about that.
yeah,
I think there was so many things in the project.
Fruit and
Yeah, of
veg
course.
jars and stuff like that. And
it's so many to remember sometimes, because then it's like
long back.
bringing them back to the surface is kind of hard. But when you get prompted by what somebody says, it's like, oh yeah, we did pulses. Oh yeah, we did this. Yeah. otherwise you wouldn't remember everything, because it was really ongoing, and it was weekly, and it was nice, very good. Yeah.
Patricia, sorry, did you want to come in there? What did you have a
No,
favorite?
really.
No.
No, I was just talking about the fruit and veg jars that we done. But I can't remember what we was doing now. I thought remembered a moment ago.
Do you mean jarred sauces?
Yeah, so hidden
veg.
Hidden veg in sauces, yeah.
In sauces, that's it. Yeah, that's well. And
I think because
healthy
I think
stuff. Yeah.
Because what happened was basically we were trying to figure out what change could be made. So there was loads of different attempts at maybe we could do more vegetables hidden in jarred sauces. So we tried that, but then it was not going to work from the industry side. And then there was oh, maybe let's try making a snack. And then it was Rosie, right? She made the pulse snack, but then we weren't sure if that was going to work. So, and then there was the fruit and veg, and then you went on to the organic veg. So it was kind of and sometimes these things were all happening at the same time, and the biomarkers. So it was quite intense.
Obviously, yeah, everything you're saying about the community research and the experience, and for a lot of communities, actually, very often they've got the skills, they've got the relationships. That's obviously why community research can be so powerful. So I guess my question, is that maybe a more traditional research project wouldn't have had community research. And I guess, where do you see the value? Why was it important that you were involved in this project in a way that if it was just led by researchers, what would be different?
Well, I think that the community trust us more. When academic, we speak the same language. And yeah, because we're just like them, and they just want to talk to somebody that understands, I suppose. And yeah, without all the jargon and the big words.
That's why we have a jargon jar.
And as part of the community, they know that we're genuine. We're down. We're going through the same things. We're all going through the cost of living crisis. We're all going through the same things, and they're willing to talk. And as being part of the community, they know us as well. Some of them know me, and yeah, that sort of thing. I don't know if you want that, Vandy. I don't really talk too much. I try.
Right. I think working as a researcher, talking to the people, the results that we were getting was we would be able to take it to the government to make changes, because there's a lot of changes that need to be made. Even the traffic light on your tins and your foods, on your foods, the traffic light, to say that you've got this amount of salt, that amount of salt, and this sugar and things in there, and to let the government know that there is change. We need change. We need things to happen. So we need that. We need more in place that people can afford fruit and veg, because then that is something that you need in your diet. A lot of people on low incomes, they were eating takeaways. They will prefer to take a takeaway because it's easy. You could just go buy it, but it's expensive. It works out expensive in the end. So this kind of research is to try and help them see that you can buy, certain things, eat fresh, and take away some of the crisp and biscuits and things that we give our kids every day. Yeah.
Mm.
So it was all about a more healthy option as well.
Yeah,
But
and that
making the government do a bit more work than what they're actually doing.
and yeah, and that speaking about this with the fresh fruit and veg, we found that a lot of the problem was single people having to buy a whole bag of veg in the store, which they're not going to use or it goes off and things like that. A lot of waste, and going back to the old school way of having the fruit and veg store was great for them to be able to pick up. If they wanted 10 Brussels sprouts, they can have 10, or without having to waste a lot of the stuff they got at the supermarket. And also about the ingredients in the fizzy drinks and putting the sweeteners in fizzy drinks and that sort of thing, the government policy on that, and trying to get things changed. And what was that thing that they was using, Vandy? Spartan something? What was it? Do you remember? Was it Spartan? Something which was
that
healthier
was poison,
than
kind of if it isn't a cleaner, a kind of a poison that they're actually putting into the foods. Why are they doing it? It's unnecessary to be putting these things, because it's going to give you more harm. It's going to do more harm to your body eventually. Because even if you take the smallest of smallest every day, you will do damage. So why are these things in in the foods?
Yeah, but there was an ingredient that was in the Coca-Cola or something that we was talking about. I don't know.
Aspartame?
Aspartan, something like that.
Something like that. Oh, okay. Oh dear, I can't remember it
Oh,
offhand now.
I think there was basically, the point of the project was that trying to find out what is really important to communities,
and that is what was important,
to kind of try to bring it to policymakers. And there was concern about food additives, there was concern about packaging, there was concern about children not eating enough fresh fruit and veg. But I also want to say, if we're talking about these kind of things, a lot of people also had challenges about time, stress, facing financial constraints. That was bringing more stress, especially where there were people that were single parents or families with children that didn't have a high income. There was other challenges for them there as well, which around that time and stress and constraints that would need to be addressed if people were going to be able to, you can't just be oh yeah, so you're working 2 jobs and you've got hardly any time, and now you've got to cook fresh food for your kids 3 times a day as well. Something needs to give if you want people to do that, or you do it a different way. I don't know. So I just wanted to add that in, because I felt we were talking a lot about what was important to the community there, and I felt like that was one bit that was missing out of the pieces that were being shared of what we found to be important.
And the schools as well, doing work with the schools, hopefully that they can introduce more of healthy eating to the children.
I remember when we were there, we did so many different methods over the 5 years whilst investigating food in your community. One of the things that happened in the later part was that you facilitated workshops and focus groups on lots of different topics like organic food and food growing and all sorts of stuff like that. Do you want to talk a bit about your experience doing these workshops and focus groups and things like that? What you learned, what you thought about, and things like that?
Well, we had fun food days. This was when we've got the community to come in, and there was loads of different projects were going around in the room. My task was doing desserts, so the children would come in and make their own dessert, and they would have a whole range of fruits. Some they knew, some they didn't. So this was a chance to give them the opportunity to try different fruits and veg, mangoes, other fruits that they have never, they've heard about them, but never tasted them. So this would help them go out there now and say, hey, Mum, can I have a mango? You know, because that was delicious what I had, you know. So it was nice. And it was great watching them putting the desserts together because they had the free range of the desserts. So that was fun to do.
Yeah. Also, we had a stall at this food workshop where, you know, the children can come in and make their own smoothies also. And what we did is we gave them a reward for trying different fruits and different veg by giving them stickers. And I found that the children were more inclined to try more different fruit and veg because they had each other and it was family orientated, and it was just a great environment. It was great to see the children making smoothies and, you know, trying different fruits like dragon fruit and other exotic fruits that they wouldn't normally try, as Vandy said, and also engaging in trying different veg that their parents were struggling to get them to try at home. So it just proves that coming together and having a meal or anything like that sort of like entice the children to do a lot more taste than that they would normally do. So that was great. Yeah.
Great. Yeah. So that was one of the methods that was used to engage the community, talk to them, but also give some benefit to them at the same time. One of the things that kind of came out of these engagements, like these Fun with Food days and then the workshops and focus groups and other things, was that some or many people were struggling to actually afford fresh fruit and vegetables. So then we had this, like, the university funded like a fruit and veg stall as a trial, and they were giving out vouchers, the FoodSEqual health thing that you guys both worked on. So do you want to talk more about how that worked and like what happened and everything? So if I could find the right slide.
Yeah, we found that the university chose a community that was, well, deemed as a more low income area in Whitley and Reading, and they gave certain roads in that area vouchers of £10 a week to spend on our fruit and veg store, which I happen to be running on a Saturday morning. And I found that it worked quite well, and people were more inclined to spend the vouchers on different fruit and veg that they wouldn't normally try in the supermarket because affordability and so on, and families that have children that are very fussy and, you know, they don't want to sort of like what's the word,
Experiment.
experiment with different fruit and veg, or explore different fruit and veg. Whereas with the voucher system, they had the opportunity to do that because they couldn't afford to waste money on different things that the children wouldn't eat. So I found that was quite helpful. And also it was quite it was like a gathering on a Saturday morning where people would just come together, and I found that the community were so helpful towards each other. And, you know, it was a beautiful thing to watch because they were helping each other with vouchers when people are, you know, short on money or short on what they wanted to get. They were sort of like helping out each other. That was a beautiful thing to see. Also, yeah, it was very good. Vandy, do you want to say anything?
Meeting some of the people from the fruit and vegetable store helped with the workshop. The workshop, we did one workshop which was organic versus non-organic, and we had like 2 plates for people to test. Out of that, the result was that a lot of people preferred the organic, so it led to a discussion about growing your own veg. And the thing is, with growing your own veg, if you have a home, you might not have the garden, the grounds to grow. So then you would look outside of the home at allotments, which are not many allotments around. So it gave people things to think about to how to grow their own. So it helped with that kind of research as well.
Yeah, definitely. Yeah, I mean, yeah, I agree. It was yeah, like, you know, kind of one thing leading into another and then leading into another, and sometimes it was all happening at the same time and it was very intense. But yes. Yeah, great. Okay. The other one of the other things that we were going to talk about was biomarkers. Oh, trying to find the right slide, so I'm going in a weird order. So as part of the fruit and veg stuff, you guys also worked with Manique to help her gather biomarkers, which were basically getting little samples of like hair and urine from people so that they could analyze like the nutrition that people were eating. So I think Vandy, you're more involved in that. Do you want to say anything about your involvement with that and what that was like or anything?
The biomarkers was part of getting samples from the same people that was doing the market stalls and other people, because by talking to them, we was able to say, do you mind helping us with this study? And a lot of people did. So they had a questionnaire to fill in. We helped by either filling it in with what they said, or they done it themselves, or we just worked together, which was really interesting, because a lot of people just took it and just said, "Oh, I'll do it," and they started doing the questionnaire. So after the questionnaire, we I took them to Malik, who would do a hair and urine sample. From that, the sample would, the results would be looking at the fruit and vegetables and the sugar intake from these samples. So so that went to the academics, and they then gave us the results back.
Sorry, there's Zoom, but I mean it's really not virtual. I'm just going to go upstairs
Yeah,
for
but the
light
results
now.
I think that was an accident.
Quite got back the results from that. Yeah, I don't think.
Sorry.
No, I don't think we have. Yes, that's right.
Yeah, but yeah, we're expecting them at some point.
Yes, we can hopefully find out from Manique what happened. Yeah. Yeah. So another thing that happened, so I hope that's all making sense to people in terms of like there were lots of different aspects of the project, like the biomarkers and then workshops and then fruit and veg stall and then these like fun with food engagement days. And yeah. And then another aspect that we were going to talk about is the fact that you guys got to go on some or like one visit to like a big food industry site where they were like processing vegetables and doing things, Barfoot's. Do you want to talk about that? Maybe I think Patricia, you're going to talk about that.
Yeah, Barfoot's was great experience. I sort of like, I found for me personally, it opened up my eyes to where food comes from, how our food is grown, why certain things are more expensive than others, like asparagus, or because it's grown as one at a time, one asparagus and stuff like that. So yeah, that was very interesting, and finding out that a lot of our fruit and veg travels and how far it travels and the carbon footprint and that sort of thing, because that's something I never really looked into as a consumer, until I started doing this research. So yeah, it was quite interesting. Vandy, I don't know if you want to continue.
Yeah, it was interesting to actually go into the actual factory to see how things were packaged as well. To know that for example, the sweet corn came in, and the sweet corn are all cut to one particular size and packaged in all different packages for all different shops. So that was interesting to see as well. It was interesting to hear about the organic side of things and the non-organic side and the pesticides. So I was surprised to learn that they do put a little bit of pesticides in the organic to help the organic fruit and vegetable grow, but these were just certain ones which were less harmful.
Yeah.
To the people. So so when I've always thought organic was organic, that there's nothing added, they have to do something to help preserve it a little bit for us as well, or
Yeah.
else we would not get as much organic stuff as what we do. So it was good to understand how to see how they prolong the shelf life of certain things, which was very, very interesting.
Coming through the project, one of the things that you did towards the end of the project was actually making the handbook, which we can maybe someone can put a link in the chat, but hopefully if you're seeing this recording, there's like a link to it there. So do you guys want to talk about making the handbook? How did you make the handbook? Why did you make the handbook? Like what happened about that and everything?
Making the handbook was great fun. Great fun, because for me, coming into this research with no experience was okay in the end, but at the beginning it was a bit, oh no, I don't know what I'm doing and that sort of thing. So we just thought we'd get together and produce this handbook for those who are thinking of becoming a community researcher, who have never had the experience like how we didn't. We was thrown in at the deep end. So yeah, just to know what to expect really. And I find it quite eye-opening and quite helpful. It was fun to make. Do you want to say any more on that, Vandy?
Yeah, when I first went, was asked if I would like to be a community researcher, I was the same as well, because Pat, don't know what we was getting ourselves into, you know. The first workshop I went to, I was like, what do I do? What do I do? What do I do? So then as you go along, you learn more and more about becoming a community researcher, which was great. So the whole purpose of the book is to help people who want to become a community researcher have an idea of what they're actually going into. And we also did this book with other other colleagues from Tower Hamlet, Plymouth, Brighton and Hove as well. So they also helped with this book, which was very interesting. And alongside that, we had Bramble, who was absolutely fantastic. Nisa, Sally, and Lorna. They worked with us to the end to help to produce and put this book together. So we just hope that it's very interesting and knowledgeable to help anybody else that would like to become a researcher.
Yeah, and to make them feel comfortable, not to, because you know fear can sometimes take over. You know, well, it did for me. But anyway, you know, I just think that having that is very beneficial for anyone who's trying to come into that kind of
And you
role.
have and we have great support, and that's what helped keep it together for me as well, because if I didn't have these certain people, Pat and everybody else to turn to, then I think I would have walked away. But because then everybody was so caring, lovely and nice, could
Team effort.
explain things to us, it made it a lot easier. So this book is hopefully that same feeling that I had, Patricia had, and everybody else had, to make it more accessible and easier to get into.
Yeah, well said. Perfect.
Amazing. So I'm just wondering if you guys want to say anything else about your experience of being a community researcher, how you feel about the role and just like your experience of that. And I noticed Lewis has come back on, so I guess we have about 5 minutes left or something.
Well, me personally enjoyed being a researcher, because every job I've done is about community anyway. So, you know, I've done care work, I've done different roles in the community, and for me, the community is it. You know, because I'm part of that community. So yeah, it was easy for me, and just gathering data and gaining their trust. You know, yeah, rewarding. And to make a difference, and especially when it comes to policy and things like that, I think that is very important. I know a lot of people had a lot to say about that, and to find out how the community see certain systems, like how they see the doctors or the police or the this or the that. It was interesting to see who they trust and things, and things like that. So yeah, I found it quite intriguing. Yeah, quite intriguing.
And out of it all, I think we gained friends as well, people that could trust us and talk to us, even share some of their own personal their personal upsets, that they had somebody to talk to. So it was a nice way of opening up and helping people as well with the food as well. So it was nice. And it was great meeting the other members of all of this as well, going to visit them as well. So that was fantastic. Yep, absolutely.
And if anybody knows people in Whitley, they know that you'll get the truth, the whole truth, and nothing but the
Nothing
truth.
but the truth.
They don't mince their words, and they're quite
Yes.
hilarious. Yeah. So it was
Yeah.
great fun.
And
Great.
still to this day, we see these people and they still say hi, and that is good.
Brilliant. Right, I'm going to uphold my promise, and I'm going to be quiet at this point and just welcome questions. I think that point about raising questions about food and what's in our food is really well made, and concerns around that. And I'm also really interested because as I say, this is generally a network from a more rural perspective, and I think obviously rural food systems, I think food is so important obviously for everybody fundamentally, but there is a different dynamic there. So I was even thinking about things like takeaways. It's not the same if you live in rural Scotland. Actually, takeaways, there are not that many of them, but there's still very many issues around food and thoughts about it. So I guess for those on the call still, welcome any reflections, questions. Chris, you straight in there?
Yeah. Hi everyone. Thanks. I've had my camera off, but I've been listening in, and it's really great to hear the work that's been going on. I suppose I just can pick up on that. Well, I had sort of two questions really. One was to pick up on that point that was just made around the sort of additional. Well, was it additional, some of that stuff that came out around the additional pressures that people were finding? So I wondered whether there's a link between not having really fixed approach to the research and being more conversational and building that trust that brought out some of those insights that might not have come out. Was it just fill out this questionnaire about what's important about food, actually because you were working in that kind of relational way, talking to people, meeting with people, that it sort of surfaced some of the additional things? I wonder whether that is, you were expecting that, or whether that was kind of also sort of demonstrates the benefit of the model and the way that you did it. And then my second question was for Vandy and Patricia about, I think one of you mentioned sort of being thrown in at the deep end when you first started the work. So I was kind of interested in whether any challenges you felt, or the sort of support that you were given, or was there any challenges in getting involved and getting stuck in terms of thrown in at the deep end, or what your perspectives were of going to be doing the work and stuff? I'd just be interested to know if there's.
No, I would. Sorry.
Go on, please.
No, I would just like to say that it wasn't really challenging once I got into it, but what the challenge was is me being nervous and me doubting my own abilities to be part of that. That's what it was for me. I don't know about anybody else, but yeah. And once I got into it, and once I learned that I'm sort of like communicating with community all the time and stuff like that, then it became easy, and it was a pleasure to do. Then it wasn't, it wasn't something that sort of like put me off or made me feel a certain way. I just enjoyed dealing with community, and then I realized, oh, this is cool, this is going to make a difference, and that sort of thing. But yeah, it's just my own thinking that I have my own shortcomings. That was it, really. Nothing to do with not being welcomed or not being helped or anything like that, because everyone worked well as a team, and yeah, it was great. So yeah, for me anyway.
Yeah, I think the same with that particular question is the same. You just didn't know what you was getting into, but it wasn't that hard that you didn't pick it up. You picked it up along the way, so you was able to get into it quite easy. The other question was doing the questionnaires with people. The questions did come up about what was in the food and with labeling and things like that. So it wasn't just something that was on our part of putting it in to the questionnaires as in the research. It was actual people saying that they've noticed certain things are going on, and if we were able to help them understand it, then that's what we did.
Thanks, Wendy. And thanks, Patricia. I think we've got
Did
time
we
for...
answer that well? Was that what you was? Did we answer that?
That's
Okay.
Chris.
Sorry.
Yeah, no, yeah. I mean, I suppose what you've described there is kind of how the questions around the sort of food were actually what people were thinking of already about kind of what's going into my food and that sort of stuff. But I was just interested also the stuff around some of the additional challenges that people brought. Like, was that built into the questionnaire already around kind of financial pressures and time pressures and stuff, or did that kind of emerge more from them because you took the approach that you took?
It was a bit of both. I think one thing led to another. Questions that we were on questionnaires led to other things, and you know, even a simple thing that, well, it might seem simple, but like Vandy was saying earlier about whether they use microwaves, this or that, and this and that. That was a big thing because a lot of people didn't want to use their ovens because, you know, it would drain all the electricity or whatever, the gas or whatever. It was things that led on to bigger things, I think. Yeah. And they'd rather use the air fryer because it's cheaper, or I'm just talking as an example, but yeah, it just, yeah.
Beautiful. Thanks,
Cool.
Patricia.
Thank you.
Thanks, Wendy. Becky, you put your camera on, so I'm going to pick on you. Do you have a question?
Thanks, Lewis. I just wanted to thank everybody for presenting because it's really inspiring. But I was keen to know, it sounds like you did such an amazing job with the research. What's next? What comes next, both in terms of the legacy of the work that you've done and for you as researchers? What's your next project?
Bramble, do you want to take that one?
Yeah, this is like tricky, I think, and it has been basically the last 2 years of the project. There was so much discussion about legacy and what that looks like, and it's been different in different areas, and actually a lot of community researchers across areas, and you guys as well, are moving back into other community roles. Yeah, a lot of the like PIs, you know, applied for like, you know, big pots of funding to try to continue directly the work, and it hasn't happened so far. So yeah, at the moment, like across the different areas, so obviously there's like the things that have been done, and there's papers and there's briefings and there's videos, and those are all being shared and promoted. And because it was part of a bigger consortium, like a UKRI consortium, there is like UKRI is the UK Research and Innovation Council, which is a government body for funding research. They funded a consortium, which is like a big group of projects. So not even just one project, there was like 15 projects. So across all of those, there's an effort to now push the messages that came out towards government and say like, look, we did all of this work in 15 projects across I don't know if it reached Scotland. I am not sure. There were lots of universities involved over 5 years. So the kind of promoting on the messages is going on at that level. But I think on the local level, it's kind of like people are trying to all find next steps and then figuring out what that looks like. I don't know if that makes any sense.
Yeah, no, that was my concern, because I think that's, you know, having been involved in other research projects where it does amazing work and then you're kind of left feeling, oh, but there's so much more we could do, but it's then trying to get funding for that. I was wondering as well, I mean, because food security and access to healthy food is now becoming such an issue for, you know, the statutory agencies, whether there was any kind of pickup from the local authority or health board or any kind of local agencies from the statutory perspective who are picking up on what we've done.
So I I know that policy in Scotland is very different. Like, I think you guys are a bit more ahead of us in this stuff, and maybe you don't agree, but like I think you are, especially have like now the like local food plans that are going to be done and everything. But in England, basically the responsibility for food in local authorities sits in public health, and it's one of just many things that they do, and they are incredibly underfunded after so many years of cuts. And it's just difficult to like grasp that. Like in Reading, there has been there's been like a food partnership that people have been like trying to set up and trying to get going, and we have been feeding into that. In fact, there's a meeting of it right now, but obviously I'm here, so I'm not there, but one of Lorna, our colleague, is there talking about this. Yeah, there is kind of like efforts around organizing at a local level, but I think it's just in England, some local authorities have chosen to prioritize this, but in many cases it's kind of falling in between. It's not a statutory requirement apart from free school meals. And so it kind of falls between. Yeah, it's frustrating. But we are like trying to engage at a local level, food partnership, etc. Yeah.
Thanks so much, Bramble. No, I appreciate that, and that's a really interesting policy difference, I think, and because also in Scotland we have Good Food Nation as well, which was a big bill, and a driver. I remember we were involved actually at Science Kaylee in some of the kind of early consultation collaboration type stuff. So anyway, we will have to finish at this point, but I think that's a beautiful note to work on. And I guess just to say a massive thank you to Patricia, Vandy, and Bramble for sharing your insights with us as a network, and for everyone for joining us for this conversation as well. So yeah, please do keep in touch. I hope you keep embedding community research in all the work that you do and all the things that you've learned and those relationships you've had as well. And yeah, just wish you all the very best and stay in touch.
Thank you. Thank you so much.
Thank you for having us. Thank you for having us.
Thank you, guys.
Thanks, everyone. Bye. Bye.